Hello, my name is Carrie Kilman, and I'm the Communications Manager for Wisconsin's Comprehensive Cancer Control Program. I am excited to talk about our approach to COVID-19 and cancer screening. We are learning as we go, so I am also excited to learn from all of you. First, I wanted to share a little background. In mid-March of 2020, we had just unveiled a new website and a brand new name. Our team had planned to spend most of last March and April introducing our new name and website to our members. The COVID-19 pandemic changed our plans. Like other cancer prevention and control programs, we recognized that the pandemic would have immediate and lasting effects on cancer-related issues and health outcomes. We knew we had an important role to play in making sure cancer was part of the evolving conversation around COVID-19. In our first staff meeting after we transitioned to remote work, our team discussed how we could best support our member organizations and respond to their needs during the pandemic. First, we realized we needed to understand their needs, to ask questions, to hold space, and to listen. Our first step was to create a simple online form where our members could share their immediate needs, long-term concerns, and questions, and also where they could offer resources they had to share with other members who might need them. We shared this form widely and regularly. An immediate need that arose from our membership was simply the need for more information from trusted sources and guidance in communicating that information to their communities. Our team redirected the bulk of our work toward helping our members understand the emerging evidence on COVID-19 and its impact on cancer. We hosted monthly member webinars about COVID and cancer, and we began amassing news stories, emerging research, and other helpful resources regarding COVID-19 and cancer, and posting them to our website. You can find our COVID-19 and cancer resource page by visiting our website at www.wicancer.org, clicking on Resources in the main menu, and then selecting COVID-19 and Cancer under the Quick Links menu. Based on early feedback from members, we created our first COVID-19 and Cancer social media toolkit, which would become a building block for our cancer screening work later on. These 10 social media graphics were designed to support the broader safer at home message by highlighting the ways that social distancing and masks help to protect cancer patients. The toolkit also featured messages directed at patients regarding the potential impact of COVID-19 on access to screening and treatment. We offered both branded and unbranded versions of these social media graphics so that our members could download the files and add their own logos. Then, late last summer, we received a request from a community partner. People in her community were afraid to go back to the doctor. It seemed like information about what was safe and what wasn't kept changing, and it was hard to know who to trust. Our partner asked if we could help by creating a clear and straightforward tool that could reinforce the message that it was safe to go back to the doctor for cancer screenings. Her concerns were backed by early data that showed decreased rates of cancer screenings and immunizations, as well as evidence that routine medical appointments were beginning to rebound among children, but not as quickly among adults. In response, we created 2 separate resources to raise awareness about cancer screenings during COVID-19. First, we partnered with the Wisconsin Well Woman Program and a health literacy organization called Covering Wisconsin to create a patient handout called Cancer Tests and Screenings: How to Safely Get Tested for Cancer During COVID-19. This handout directly addresses patient safety concerns, explains in very simple terms what cancer screenings are and why they're important, and reiterates important COVID-related protective measures. In determining the content for this handout, We listened to feedback from our members regarding the most common patient fears, questions, and concerns. We crafted a message that was direct, factual, and encouraging. We acknowledged the fear that patients were commonly reporting, but we did not dwell on it. Instead, we aimed for a positive, trustworthy, and action-oriented tone. Our second cancer screening resource was a social media toolkit that specifically addresses the importance of getting screened for cancer during COVID-19. This toolkit includes 10 social media graphics formatted for Facebook and 8 formatted for Twitter, along with sample post text. We designed this toolkit last August, 5 months into the pandemic. By that point, COVID had become unfortunately politicized, with harmful messages being widely shared online. With this toolkit, we aimed for a broad audience. We hope that everyone takes COVID seriously, wears a mask, and practices rigorous social distancing, but we know that's not always the case. We wanted our messages to resonate regardless. So we focused on the future, the joys we all look forward to after the pandemic, and our collective longing to once again be among loved ones. The text for each graphic varied, but almost all of the graphics contained a common phrase: stay safe, wear a mask, get screened for cancer. By repeating this phrase throughout our materials, we wanted to remind viewers that cancer screenings are a safe and essential way to protect their health. We wanted the messages in this toolkit to have broad appeal, but also call to mind a specific happy memory or hope for the viewer. We started by holding informal focus groups to come up with lists of things we miss from before COVID and things we are looking forward to after the pandemic is over. Our final list included things like weddings, graduations, seeing grandchildren, going to church, music concerts, county fairs and festivals, birthday parties, playing cards with friends, and hugging the people we love. This list inspired the tone and language used on the graphics. Because so much of social media relies on visual impact, we took a lot of time selecting the images. At first, we thought we would use wide-angle photos of concerts and Ferris wheels and large gatherings of people, representing so much of what our communities lost when the pandemic began. But as we continued to hone the look and feel of the toolkit, the images that had the most impact on our beta viewers were the close-up pictures of individuals and small groups of people. In our mission statement, we intentionally used the phrase "for everyone in Wisconsin." Likewise, when choosing the images for this campaign, we aimed for broad and intentional representation. These social media graphics can be used as an image slider or as a standalone post. When used together as a slider, they conjure a rich sense of community. People from different backgrounds and cultures and beliefs who share a common desire to safely get to the other, more joyful side of this crisis. We partnered with the Wisconsin Broadcasters Association to amplify these messages. We wrote 3 versions of a radio PSA, a 15-second, 30-second, and 60-second script. Each one emphasized not only the importance of getting screened for cancer, but also the fact that it was now safe to do so. These PSAs were aired 6,549 times across 182 radio stations last August and September. 42% of these announcements aired during drive time. As a companion to the PSAs, the Wisconsin Broadcasters Association shared our cancer screening social media graphics in their slider form with radio stations across the state. On a single day last August, early in the radio campaign, our social media slider was shared on Facebook by 42 radio stations with a total reach of 2 million people, and on Twitter by 22 stations with a reach of 391,000 people. Our communications intern tracked the geographic location, genre, and audience reach of each station that shared our social media slider about COVID-19 and cancer screening, and we were able to see that it was viewed in every region of the state. We have promoted and supplemented these resources with about a dozen articles about COVID-19 and cancer screening in our monthly member newsletter, in special email blasts, and in our monthly member webinars, which frequently focus on COVID and cancer. While it's too soon to see the real-world impact of this work, we know that our COVID-19 and cancer screening social media toolkit remains one of the most commonly downloaded resources on our site. And our COVID-19 and cancer resource page continues to grow to meet the needs of our members. It now includes both of our COVID and cancer social media toolkits, our cancer screening how-to sheet for patients, past COVID-19 and cancer webinar recordings, a resource we developed to provide COVID-19 related guidance to local governments and businesses, our member feedback form, and many other external resources organized by audience type. Overall, we have focused our COVID-19 and cancer screening messages on the following basic points. It's safe to go back to the doctor. Cancer screening can save your life. If you've missed a cancer screening during the pandemic, it's time to get back on track. And help is available if you don't have health insurance or if you don't know what your insurance covers. As the pandemic continues and new data emerges, our messages likely will evolve to include other barriers to screening, targeted messaging to populations with lower screening rates, the role of telemedicine and technology-based tools for patients and healthcare providers, as well as any future policy changes that affect access to screening. We have done a lot of this work by trial and error, but we have learned a few takeaways that are worth passing along. First, figure out who your audience is, what they need, and who they trust. Consider how you want your audience to feel and what you want them to do as a result of your messaging. Use simple, respectful, straightforward language. Be inclusive of race, age, ability, income, gender, sexual orientation, religion, political belief, family composition, the list goes on. Remember that the same messages do not work for all audiences or for all platforms. You don't need extensive graphic design experience. Free online graphic design editors can make this easy. It's okay to try several different approaches before you figure out what works. We are always learning from others, and we would love to hear from you. If you have questions, please get in touch. Thank you.